Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. Welcome everyone to another amazing episode of Telehealth Tuesday. First of all, this is your go-to podcast for insights on modern healthcare and wellness solutions. I'm your host, Dr. Michael Bookhart, and today we have a very special episode lined up for you. Now, look, before I tell you about my next guest with an S on it, plural, I want to take a moment to thank our sponsors for tonight's episode, Graphics R Chase, P5 Solutions, and as always, Adama Dynasty, Greek Apparel Corporation. Now, I also want to let you know that Telehealth Tuesday can be viewed on multiple platforms. So, number one, our YouTube channel, which is Dr. B TV, the word DOCTOR, the letter B as in boy TV. Also, you can find us on Good Faith Wellness Center, Instagram and Facebook pages, respectively. So please follow, like, share, and subscribe to help support this program. Lastly, quick announcement: we wanted to remind everyone that at Good Faith Wellness Center, all new patients for the month of December, all the way to December 31st, we will waive your copay, which has never been done before, probably in the history of any practice. But all new patients at Good Faith Wellness Center, new patients, we will waive your copay. All right. So look, now that we got that out the way, before I bring on our special guests, number one, let me introduce Dr. William North. He is a board certified plastic surgeon specializing in cosmetic and reconstructive procedures for the breast, body, and face. He's known for his innovative techniques in breast reconstruction. He's received the prestigious Glancy Award and has been published widely in leading medical journals. Dr. North completed his residency at the University of Kentucky Medical Center, earned his medical degree from the University of Mississippi, where he graduated summa cum laude and Phi Beta Kappa. I'm going to let you talk more because we don't even have enough time for me to tell you about all the accolades of Dr. North, so I'm going to let him tell you a little bit more as well. Lastly, I want to talk about Ms. Jasmine Briscoe. She's come to be a friend of mine, and I've also experienced her amazing massage, all her new innovative techniques in massage therapy. She is absolutely amazing. She specializes in fibrosis reduction. She's also a certified lipotherapist, a sculpture therapist, and non-invasive body contouring and beauty enhancement technique educator. So without further ado, I want to introduce both of my guests. They're here live. Hear ye them, Dr. William North and Miss Jasmine Briscoe. All right.
Thanks for having us on, Michael.
Absolutely. Good evening, everyone. Jasmine, we can't. Okay, there you are. There we go. See you there. There you go. Okay. See if you can move just a little bit, Jasmine, to your left, my right. Okay. Yeah. Perfect. How are you guys feeling tonight?
We're doing great. It's a busy month of December.
Yeah. Absolutely. Absolutely. I see we've got a couple of folks already in. Look, folks, this is the episode. I want y'all to know we are here. We've got the specialist here. We've got a board certified plastic surgeon here for the first time on our show. I know that everybody's anxious to talk about these BBLs, Dr. North, all this body contour and all these folks. That is such a hot topic. So let's get right into it. And guys, if you all want to ask any questions, no question is off limits. So please keep them coming. Thank you all, everyone, for joining. So right to it, Dr. North, what exactly is a BBL, Brazilian butt lift? And, how does that differ from other contouring surgeries?
Sure, that's a great question. So it's really interesting. As plastic surgeons, we lift things and we tighten things. We make things smaller and bigger. And when you talk about a BBL, that stands for Brazilian butt lift. And in actuality, you're not lifting anything. You're filling parts of the body that have a deficiency. And the way that we do that is we take from certain areas of the body where fat doesn't belong or we don't want it, and we put it where it does. And so by using your own fat, where you're not using an implant or anything foreign that has to be changed at some point in time in your life, you're taking fat out, especially from the waistline or unwanted areas, inner thighs, abdomen, arms. We're taking that fat, centrifuging it, and getting the good fat out of the bad fat, throwing the bad fat away, and then using that good fat to layer certain areas of the body, primarily the outer hips and the top of the buttock. Lay it in there so that it becomes vascularized, gets good blood flow, and we use that fat to augment the buttock. So it does lift, but it's more of a shaping operation. I think we call it BBL because everybody knows it as a Brazilian butt lift, and it does lift, but the the
Mhm.
best results aren't just about lifting, it's about taking away to enhance the areas that were smaller and wanted to be larger.
Okay. Excellent, excellent. And by the way, before I'm just going to test something real quick because I was getting a little bit of a hum in the background. Let me see if that's from a.
Hey, Brittany.
Let's see. I was wondering if that. Let's see. Okay, that's actually.
I can unmute it right there.
Yeah, no, that was actually with. I think Jasmine. Say, Jasmine, can you hear me still?
Yes, I can hear you.
Okay, that is coming from there. Is there? I wonder if there is there a fan or anything blowing, or it's like a hum, but or maybe it's the machine. Maybe is that the machine going? Is that the machine like a hum?
Mm-hmm. Want me to move it?
Well, no, no. I was just wondering, like, it does it make like a hum?
Mm-hmm.
Okay,
Yeah.
maybe that's that, but that's fine. That's okay. I was just wondering to make sure. But if everyone can hear us, that's no problem. We've got look, they're pouring in. The questions are pouring. I knew they would. So, all right, let's see. Somebody saying, "I know Jazz." Oh, that's Brittany
Right.
Coleman there.
Here you go.
Brittany Coleman is awesome. Okay, first question is, do they accept BCS Blue Cross Blue Shield? Do you accept Blue Cross Blue Shield, Dr. North?
Yes, we do. There's certain things that your insurance provider will be able to help cover as far as plastic surgery. Number one procedure that probably Blue Cross Blue Shield is great to work with is a breast reduction. Because a lot of times, if you're able to help patients feel better about their bodies in regards to the breast size, that benefits their overall wellness. I've had patients get off their antidepressants, start eating better, be able to shop for new clothes, become more social. When you don't, all of us, when we're tired, when we're hurting, when our back hurts, we've been at work all day, you go home and you think you need to treat yourself to something that's usually unhealthy just for a small brief moment to feel better. And so
Mhm.
Blue Cross Blue Shield is pretty good about allowing me to dictate or type out a little note saying my patients are having a hard time because their breasts are too big. And my goal as a plastic surgeon is not just to go from a double D to a C cup. It's really more about shape.
Okay.
Shape is what makes the body look good, not size, whether that's the buttock, the implant, the breast volume. It's we are geared to look at shape as something that's pretty as far as aesthetic, not just how big something is. Because we all know big may look good and may look bad on some patients. So you want to have a good shape, and that's what plastic surgery really is about, no matter what type of or part of the body you're operating on.
Awesome, awesome. So there you go. Hopefully that answers your question there, Brittany. We've got things are pouring in here. Heidelberg says, "Look at my look at my bestie Tierra Williams acting like a mannequin." All right, we appreciate. Well, we'll keep them. Oh, by the way, so Jasmine, I want Jasmine to get on in there. So you heard Dr. North's explanation, and we talked about what a BBL actually is. When it comes to the contour, and he spoke about the shape. With what you do with your practice, are you able to influence the shape, non-invasively from the outside, without surgery?
Yes. The main thing I like to do, especially like if they want to enhance their buttocks, I
Hmm.
enhance their waist first because one thing about if you shrink one area is gonna, you know, enhance and magnify the other area. And then with the cellulite, so if they have cellulite or their legs kind of heavy, they want to contour, smooth it out, give a more smooth shape to their glutes and, kind of reshape it. Most of their issues too, they want heavier looking hips. So I kind of get that thigh area meat, the lower under the buttocks area, and kind of round it off and lift it, and it's it kind of it's better for me to like to work and show you whatever. But yeah, I enhance the waist and the top of the legs to round the glute area if they want to enhance the buttocks area.
Okay, well, hopefully, and I know that this, it's a 1 hour show, and so what I may do is just to see if I anticipate that the questions are going to keep pouring in.
Mm-hmm.
Sometimes with the more popular shows, we might ask that if you all have an extra 10 minutes, because I know in my mind, Jasmine, I look at, I see that you have our lovely model there. Probably at some point, maybe you can demonstrate some of the things that you're talking about, whether it's lymphatic massage or the contouring. But let me go. All right, Brittany's asking us, all right, what about, so this is a question for Dr. Noor. What about the downtime is one question, and let's put that other one up there. So what about the downtime? I guess, Brittany, I don't know if you're talking about BBL specifically, but if you are, and then the other one, what about women who have had C-sections? Can it be less invasive? So about women that have had C-sections, can it be less invasive? And what about the downtime?
I'll just uh, answer all the questions kind of in a broad sense. The downtime for a breast reduction is about a week. And I think that most patients who have an office job can go back at a week. Um, that's not to say that they can't fall in the office and pop a stitch or cause a increase in their blood pressure and cause some swelling. So if you have the opportunity to take 2 weeks off, that's great. I think most people are out of the quote woods of having any kind of problem at 3. As Jasmine knows, sometimes if people have had liposuction and they're coming in to see her to help break up that fibrosis and get those lymphatic channels open, if you're doing too much, you can cause an elevation in your blood pressure, whether that's from stress, strain, or just daily life or bad diet, high salt diet, not taking your medicine. That can in turn cause soft tissue swelling, which can cause stress on your incision, which can cause scarring to be worse, and also prolong recovery. Just getting to where you want to be quickly is the most important thing. If you're choosing to have plastic surgery, whether it be for cosmetic or just to be more comfortable with yourself, the main goal you want to be is just be back to you and start enjoying your results. So having a two-part approach of not doing a whole lot so that you're not in Jasmine's office every day because you've got these pockets of fluid that she's trying to work out. You want to be able to see someone like her so that she can smooth things out, but it's not like a repetitive issue with having fluid all around the tummy or the breast. As far as C sections with less invasive, the number one thing in pursuing plastic surgery is it's just like taking a test in school. You want to feel like you know all the information and go in there and take the test and be ready to make 100 on it. Just like surgery, you want to be at the tip top shape, kind of have good nutrition. I can do the same operation on 10 different men or women, and they can have 10 different results because number one, genetics plays a part. Even if I do the same techniques, their nutrition plays a part. You want to be thinking about protein, and I've seen a transition in today of trying to stay away from processed foods. Those are all good things to have to be able to have a great result. With exercise, you can tone the body, but a lot of patients that have had C sections have developed a adherence of the skin flap that where they make that up side to side incision. And unfortunately, you cannot exercise skin away. And there are some machines that come out every couple of years about trying to tighten the skin. And I've found that those can sometimes be unreliable because you're just trying to burn the skin and getting it tightened, but it's actually that deep scar that needs to be released
Hmm.
so that the skin can lay flat just like the sheet of a bed. If you've got one wrinkle in it, you can never get the skin to smooth out. Some of Jasmine's techniques are able to smooth that out and get the fluid and the fibrosis down. But if you've got a dense scar, sometimes the only way to release it is to do it surgically, which with numbing medicine and the gentle techniques doesn't have to be a rough procedure.
Excellent, excellent, excellent answers, Jasmine. I want if you want to weigh in. Do you want to weigh in on any of that? Do we have it? Do you have 60 seconds to maybe demonstrate? Are you able to on your model there how you might do some of that with lymphatic massage on the on maybe on her arm or something like that, or leg? Are you able to do that?
Okay, I can.
I just wanted to include you on there. Dr. North was referring to that and saying people coming to you. So I just want our viewers to understand what he was describing there.
Okay, like especially like in this area, like he was talking about, like scar tissue or flap
Hmm.
is an area most of my women like to complain about or whatever. I like to use this one of my wood tools right here. It kind of help break up scar tissue or whatever to see can that help them with flattening and smoothing up. But like he said, if that's not enough, we can try something else. Like I do localized cryo. They can help tone and tighten the skin, but that's not effective to everyone. They might have the extra skin they want to remove too. But something like this, I break it up, and then after I break it up good, I activate the lymphatic system so their body can get rid of that scar tissue or the extra waste that's holding it.
Okay.
So we got lymph nodes in this area that I definitely activate to help release that area.
Excellent. Excellent. Well, I appreciate you. I appreciate you doing, like I said, the questions are rolling in. So thank you for that, Jasmine. Let's see, let's go to Anita, who is asking a question here. Anita says, how do you approach, so this is for Dr. North, how do you approach patients that are seeking corrections to previous procedures? Great question.
It's a good question, Anita. I see a lot of patients that have had other procedures, either by somebody else recently or before I was in practice. And the main thing is, I just try to connect with those patients to make sure that the patient as well as myself have a good connection, a common goal. I mean, you want to go see doctors that you trust, that feel like they have your best interest. And that's with anything. You don't buy a car from somebody that you think is trying to swindle you. And there are places in America where cosmetic surgery has become such a money thing that
Mhm. That's
people are
right.
swindling, and you can't believe what you see on Instagram because they pay somebody to market them, and it just can be almost false advertising. But I see patients, I find out what they feel like went wrong, what they'd like to improve, and then we talk about a mutual or a plan for each one of us to like and undergo, and then pursue that so that we know we can achieve a result. Because you can see patients that have unrealistic expectations. And as a doctor, you have to say, well, here's what we can do. We can do this safely. Can this be done? And see if the patient is agreeable to that and if that's what they're trying to accomplish. So it's really more about when I see patients that need something and if they feel like it's wrong, my goal is to diagnose the problem and then figure out, okay, here are a couple of things that we can do that may or may not be without risk to help correct whatever we think is abnormal at that time.
Awesome. Awesome. Let's go to Caroline. Caroline has a question. Caroline Cardwell. I think I don't recognize that name, so thank you for joining, Caroline. Let's pause for the cause. Thank you all. So much interest has been on this segment. Thank you all for always joining. I see some familiar names, some new names. So welcome to Telehealth Tuesday. Just a friendly reminder: this is a program we're doing every single Tuesday, 7 p.m. Central Standard Time. And tonight we're featuring Dr. William North, plastic surgeon, and also Ms. Jasmine Briscoe, certified lymphatic massage therapist, body contouring expert. So, Caroline's question: does breast reduction reduce your risk of breast cancer?
This is this is a great question.
Very great question.
There have been a lot of studies on this. Certainly, breast reduction doesn't increase your chance of breast cancer. And there have been times where I have done a breast reduction on a patient that has had benign mammograms, and I've sent that breast tissue, and they found little microscopic areas of ductal carcinoma in situ or small areas of breast cancer. So, as a rule of thumb, if I take any significant portion of breast tissue out, whether it's a breast lift or breast reduction, I will send it off to be tested. So that in
Okay.
turn allows you to actually have a pathologist look at your breast tissue. So you could
Mm,
say that that right there reduces a chance of breast cancer developing into a real invasive uh, type of cancer. But there have been studies that show that by reducing the volume of breast tissue that you have, can reduce your chance of breast cancer. I don't advocate to get a breast reduction just to reduce your chance of breast cancer, but in theory, if you're taking something away, there's less cells to potentially have a mutation and cause cancer.
That's interesting. So just and that was interesting for me because I know you didn't know this, William, but I used to be a surgical technologist, and I spent a year doing plastics. A lot of times we were doing a lot of breast procedure. We did rhinoplasty, we did tummy tucks and lipo, but we mainly he was a breast expert as well, and we did a lot of implant. He didn't do too much reduction, but we did a lot of implant. But anyway, so what you said, anytime you take a significant amount of breast tissue off, so that's always going to the. So like say if it's a smaller amount, that amount does not necessarily go to the pathologist for like a permanent or anything like that.
It's if it's a small enough amount to where I think it's
Hmm.
a palm size even, I send it because
You said okay,
I would rather the patient get a bill from the, and I speak to them preoperative about this, get a bill from the pathologist saying you owe me $150 because I told you there's no cancer in this. Then 5 years later have a cancer pop up and say, why didn't we send that? Man, I wish we had. So it makes me feel better. I think it's worth the cost of you know peace of mind.
okay, awesome, awesome. Let's see. Let's go to Lisa. This looks like a question for Jasmine. I think Jasmine, you over. I think you might be on the side. Can you hear me still?
I can hear you.
Okay, okay. Lisa has a question. So, how can I support my lymphatic system at home between sessions? Great
Okay.
question.
I have another model. Like I like to encourage dry brushing, and she's gonna show what I like to tell you to do at home. Gotta start from your feet. You gotta start from your feet. You can start from your feet. Dry brushing, swiping up to activate your lymphatic system. Your main goal is to pretty much pump all the toxins and waste up towards your heart so it can pump it out through your lymphatic system. We have lymph nodes under our arms, up under like our rib area, down in our groin area, and over 25% of our lymph nodes are in our upper body. So if you want to pretty much just work around your clavicle area, that can help you dump off a lot of excess toxins and fluid in your body. If you want to deal with back rolls, it helps with that too. That's an effective way to keep your lymphatic system going and help pump out that stagnant fluid that may be locked in your body.
Awesome, awesome. And that's your referred to as dry brushing.
Yes, and I also have a wooden belt I like to let them use too for self care.
Oh, she's she's got you got it all. Okay, so that's a you're seeing it first here only on Telehealth Tuesday, everybody. She's so that's a wooden belt for
You can use it
increased.
for contouring. You can use it for lymphatic drainage. You can use it for the enhance, the cellulite, the inner thigh area. It's really beneficial to use at home just to in between your sessions or just to, enhance your beauty and your wellness. So I
Awesome.
would encourage that at home as well.
Awesome. Thank you so much for that. That is great question and an even better answer. All right. Let's keep it rolling. They are pouring in. We have attorney Felicia Shepard, who thank you so much for joining another new viewer. Welcome to Telehealth Tuesday. Felicia says, what levels of blood pressure do you consider unsafe for cosmetic surgery, and what if the patient is on blood pressure medication already?
Great.
Excellent
You know,
question.
you want to only have surgery when it's safe to do so. Plastic surgery is not your appendix; it's not your gallbladder, and so occasionally, things arise preoperatively that we try to prohibit causing a problem later in your recovery. So we have you come in for a preoperative visit to see our pre-op nurses and get an EKG do a set of vitals, go over medications that you should take. We do have our patients take a thyroid medicine, any seizure medicine before. I have lots of patients on blood pressure medicine, and oftentimes we have them take that so that we make sure that it's controlled. Because after surgery, after anesthesia wears off, your blood pressure does raise up a little bit because they have to decrease it some. So during the surgery, we maintain that blood pressure at a stable rate, and then afterwards, you continue taking your blood pressure. So it's really more about if you have uncontrolled blood pressure, that might not be amenable to having surgery at that time. We want to have patients that have stable blood pressure that's around normal, the 120 over 80 or below 140 systolic prior to surgery. And, when I see patients, we do a consultation, we discuss those things, and if we need to have them evaluated by their primary care physician or a heart doctor, we help work them through that. So I can't put a number on that, but if it's something that's late, up and down, that's what we want to control.
Awesome, awesome. That's an excellent question, Felicia, and I'll probably chime in just very briefly on it because after doing hospital medicine for several years, and we work with at this particular facility, we work with a lot of orthopedic surgeons. We had one or two plastic surgeons, but basically, like he was saying, all the most surgeons want, like you were saying, systolic, the top number, 140 or under. And so that's exactly what we would do in terms of, the surgeons send the patient to a family medicine or internal medicine doctor for surgical clearance. But, that was one thing at UMC. One of my professors, one of the attendings said they would hate using the word clearance because they would say only the surgeon can, clear people. We just make recommendations. So, but either way, very rarely would I, as a primary or a hospitalist, just recommend to the surgeon, hey, don't do the surgery or stop the surgery. It's very rare, but like I say, there have been times when it's been a little over my comfort level, and I might recommend I would give the surgeon a call and say, hey, a little worried about this one, and he or she would use their discretion and say whether they want to proceed. And like you said, it's not. It depends on the type of surgery as well. Cosmetic surgery is different than aortic surgery and brain surgery and all that. So,
Mm-hmm.
but yeah, okay. Uh, Heidelberg, we got another question. This is what actually does lymphatic mean in layman's terms? I don't know if y'all want to jump. You want me, you want me to base?
I can. I'll say a little bit about what I know through my, you know, experience with breast cancer. The lymphatics do two things. I think you can think of it as a layman's term, meaning filters the body. It filters the fluid. It gets it to the kidneys and the liver, and it's just an extra road or tube in your body
Mhm.
besides your blood vessels that filters fluid. In patients that have had parts of their body removed or breast cancer, the lymphatics help send a message to the areas of the body that create antibodies that kill bacteria. That's why patients that have breast cancer are more susceptible to infection because their body can't recognize bacteria because those lymphatics are the channels in which the body communicates and helps the body recognize an antigen to create an antibody. And we know about these words now because of COVID and the antigen antibody shots and all this kind of stuff. But the lymphatics help your body recognize problems and send messengers and help that way, as well as serve as a filtration system.
Absolutely. Excellent. Excellent. That was excellent definition. Let's see. We've got a question here, Lisa. Boy, they just pouring in, man. But keep them coming, folks. We want this interaction. I definitely appreciate this. Um, Lisa's okay. Let's see here. What are the potential long-term risks and complications associated with BBL surgery, and how do you address the possibility of fat embolism or other life-threatening issues? Wow, quite a question there.
Mhm.
Quite a question.
Jasmine, do you see many patients that have a problem that come to you after BBL or liposuction?
Not necessarily problems. They come in with, the unsatisfactory of having extra retained fluid or something like that.
Yeah.
I have had people say, "Well, this hip a little higher than this one. Could you work more on this one?" I'm like,
Right.
"No, we can let your body heal.
Yeah.
I'm sure your body probably was already made like that before they did the surgery. I'm trying to, you know, I can't change your body."
Sure.
So, yeah, I feel
We.
like a lot of it needs to be more of a reality standpoint of when people go into it, they want to go in one way and come out looking like a Barbie doll. Like I've spoke to several of my clients, they feel like more than one surgery is too much. But I said if them the results you want, some people it requires more than one surgery. You can't get
Yeah.
a whole bunch done at one time. They may develop more scar tissue or something like that. You may need to heal and get back to work, so you should break it down. But I feel like it's more of research and reality when you're going into something. You have to be honest with yourself. You got to have a good support team. You got to be positive. You can't talk negative. Negative talking to yourself can make your body throw off hormones and fluids and stuff, so you're gonna swell versus heal. So
I
I
can't. I can't. I can't agree with that more. I'm a firm believer in people that think positive and know they're going to do well. They end up doing well, looking at the
trust the
brighter side of
process.
things.
Trust the process. You can't
Absolutely.
2 weeks later be like, okay, I'm still swelling. Okay, your body's still healing. Your body doing what it needs to do to
Yeah.
get where it needs to go.
Yeah. I tell my patients at 2 months, 60% of the swelling's gone, and after that 2 months, getting that last 40% down is pretty frustrating. But with the long-term risk and complications, as Jasmine mentioned, like some patients want to have a very enhanced figure. And so that sometimes can take a lot of liposuction, which is more anesthesia, which has more risk. And it also can take more fat underneath the skin above the level of the muscle to get the desired result. And there's only so much your skin can expand. We're taught as physicians to place the fat and not overdo it because it's just like if you are planting flowers and you put too many seeds in one flower bed, some of those seeds are going to die because they can't get water, they can't get nutrition. Same with fat. If you put too much fat in an area that doesn't have a good bed to live in, some of that fat will die, and that fat can, number one, cause a lump or a bump or a scar tissue. It can also cause an oil cyst, which has to be opened and drained. And then on top of all those little small things, if, as mentioned in the comment by Lisa, if you put too much fat in one area, it
Hmm.
has a tendency to cause more trauma, which can cause a cut in the blood vessel, which can suck up fat just like a vacuum cleaner. And that fat turns into a little ball that forms a fat embolism, goes to the lungs and can shower your heart and your body, which can be fatal. So they've done a lot of restrictions, especially in Florida, about how many surgeries particular doctors can do in one day, and certain guidance on BBLs when it started to be a thing. So we avoid the fat embolism by not injecting too much fat, by knowing the patient position, and by putting the fat above the layer of the muscle, because that is the life-threatening condition.
Mm.
In my experience too, with the third
That's
and fourth week post op, I feel like most of my clients they go a little backwards because of their expectation. They become impatient after the second week. They were like, "Well, I have results. Now I'm back swelling up." I'm like, "Sometimes your body gonna go up and down. Maybe it's something you ate. Maybe you're not wearing the proper garment. Without you probably wearing two garments, one looser than the other one. Your body
Right.
creeping up and down. You letting your body do like a rubber band, so it's used to going up and down. I don't know what you're doing. We got to talk about it and think about what you're doing.
absolutely, absolutely. Well, man, this is, I'm telling y'all, this is, I've said this on several several episodes, but I really mean it this time, guys. This is the most participation that we have ever seen, and it's growing every week. But thank y'all. Please keep them coming. I'm just gonna keep hitting them here. Let's see. Next question, Ms. Walker. Oh, that's Sean. What's up, Sean? Do you recommend lymphatic massages for someone with neuropathy? Maybe I will post this question to Jasmine. Do you have experience? So just so everybody knows, when they talk about neuropathy, when people say that I'm having tingling in my arms and legs, we say, especially a lot of diabetic neuropathy, people with uncontrolled diabetes, which is we see that all the time in the South, where they can't feel their feet and they step on nails and they don't even know it and they end up getting tetanus and gangrene, all this stuff. So anyway, those are the people who have the numbness, tingling, and sometimes they lose the sensation. And so the question is, so Jasmine, do you have experience with that, doing lymphatic massages with people with neuropathy?
Yes, and then like most of my people do have issues with like any type of tingling and stuff like that. I do recommend manual lymphatic drainage because my experience with having entrapped nerves, I felt like the fluid in my body was compressing my nerves. It wasn't letting them fire off and signal. So I feel like that's one of the signs that your body needs to decongest and detox any type of numbness and tingling. So
Absolutely. Will, I don't know if you want to comment on that or you want me to keep rolling about the neuropathy.
I'll leave it to Jasmine. She,
Okay.
she's all
I'm
about.
trying to keep it simple because I can run off and go a lot of different places. Now I'm trying to keep my mind
Oh yeah. No, I
on.
appreciate that. Oh, go ahead.
But
Okay.
just experience just fluid in your body, just like I've had people that were diagnosed with sleep apnea, and once they got the fluid off their body, they was having less problems breathing. So I feel like just any extra fluid inside your body can have you tingling, trouble breathing. It just gonna mess up your whole body because it's gonna be an extra weight on your vessels. So that's just my simplest way of putting it. Like so, neuropathy is
Absolutely.
more common and to me now than anything. Like everybody complain about numbness and tingling and all that, but everybody like
Hmm.
to flame now.
Absolutely. And yeah, you're absolutely right with that. And go, Joe. Reeve said they should come to Good Faith Wellness for your blood pressure and help your life. Yeah, absolutely. Hey, look, I appreciate that. Um, you, so yeah, I'll put a shameless plug then for Good Faith Wellness Center but no, seriously, we do support the whole person. I think that we were talking about this before the show. There are multiple ways to treat. There are certain procedures that Dr. North will do that are, purely cash based, purely cosmetic, and there's other ones that insurance pays for. Maybe they're medically necessary. There's work that Jasmine does that, is needed. Some people need massage, they have chronic pain. Some people just want massage because it feels good and they just get a little Swedish kind of thing. So, but definitely that's why at Good Faith Wellness Center, this is a patient centered medical home, essentially a multidisciplinary practice where we have different ways, in whether we're referring them out to Dr. North, whether we're sending you to Jasmine. By the way, Jasmine, although she doesn't know it, she's going to start doing those services here at Good Faith Wellness Center. All right,
Okay.
let's we'll keep on going. All right, let's go back to another question. What weight level and age should someone be before considering plastic surgery?
A lot of practices have big things on their website that says do not come and see us or don't bother calling us if you have a BMI above this level. And one time it hurt my feelings. A patient came in and said, I almost didn't come to see you because you say you don't do plus size patients. And I said, I never said that. They said, well, you don't have on your website that you do plus size surgery. And so I put that on there because I guess people are looking for that. I personally, as a physician, I don't have a cutoff of age or weight. I look at the patient because I'd rather see them early. If they're planning on wanting to lose weight, then I can help guide them through that and give them some goals and just something at the end of the line for them to look forward to in regards to what plastic surgery is potential and safe at that time. As far as age, I look at maturity level of the patient, and then Jasmine touched on it earlier, like social support afterwards. If a patient is young and coming to me with their mother and they're both talking about what issues plague them, because there are small issues about our lives that may cause a big problem in our own person, but don't bother anybody else, whether it's a tiny little mole or our breasts are too large or too small, or we have some wrinkles that we're worried about. Even if you're 74 and you're healthy, you may have the same risk factors as a 40-year-old. and you're both pursuing the same surgery. So I look at everybody as a whole. I don't have a blanket algorithm term that says, you're 72, you can't have this, or you're 17, you can't have this.
Absolutely. Absolutely. Excellent question. Let's see. Two kids. Let's say I have two kids age 15 and 5, but I've not been able to, let's put that up. I have two kids age 15 and 5, but I've not been able to gain no matter what. And I'm considering implants, breast and butt. All right.
I think having two kids, 15 and 5, you're busy and don't have much time to concentrate on yourself. And I assume you're meaning gaining as in size of the buttock as well as the breast. It's doable and it can be safe, but there are a lot of problems with having a buttock implant because that's the main area that you sit on, and it can be uncomfortable and they can shift and they can cause some pain. So for a lot of my patients, I recommend trying to do what you can to increase the buttock muscle prior to surgery. That is much less invasive, and it's something that by building muscle, you can get a better shape. Now, if it's skin that's sagging around the buttock and you can't feel that skin out, then you may need a lower back lift or a buttock lift, we call it, to help tighten the skin envelope around the muscle. As far as the breast, a breast lift can be done as well as a breast implant. Breast implants are the most commonly implanted device in the US. As far as medical
Mm,
device studies have shown, they're safe, and complications happen in breast implants a lot of times because I think it's the wrong candidate or the breast implant was too big. And so by choosing the right surgeon and choosing the right operation, I think you can successfully improve the appearance of the breast and buttock. The buttock, you can add fat to that area, but you have to be real careful about buttock implants. Those can be fraught with complications just because you sit on your butt and it's hard to lay even after you're healed on a foreign object because it's right there on that pressure point.
okay, that's awesome.
I
That's awesome. I see you're in the back there, Jasmine. Well, yeah, what you gonna show us some?
want
I
to
see you
say
got those
something to
cups.
Dr. North about the butt lift thing, whatever about the sciatic nerve.
Yeah.
To me, I feel like the BBL put extra weight on that sciatic nerve that's on the back of your thigh. So that BBL pillow to me had me iffy because I feel like they mess with the circulation and the blood flow in your thigh area to your butt.
Mhm.
So, how do you feel about the BBL pillows?
That's I've had patients say similar things because sometimes I'll have them wear compression socks, and they'll
Mm.
call me and say my leg is dying. I can't feel my leg, and it's because the sock is so tight it's crushing or compressing the deep perineal, the perineal nerve, which supplies the
Mm,
sensation of the foot. And so I think you just don't want to lay on something for so long that it causes neuropraxia or oxygen not to get to the nerve. And so the BBL pillow is probably better than just sitting right on your buttock, but it's often good to put a pillow at the knees and then a pillow at the back so your butt's really hanging, and put a trash bag under there, something just to keep yourself from compressing because you don't want to put pressure on any part of the body for too long, or you can have potential side effects like that. But yeah, if you're
For
feeling,
blood circulation, and they
yeah,
can keep the
if
fat
you're
down.
too long, position changes every 15 minutes or so
mm,
is valuable for that.
absolutely. That's great. Were you gonna? You It looks like you were gonna show us. You're
Yes.
gonna show us something there, Jasmine, with those cups.
Yeah. Like right after that BBL, you can't put too much pressure right here, or whatever. But since they be wanting to increase, circulation in their leg area, whatever, I like to use my wood or metal tools just to help increase that. So I use something like this just to help them with their blood flow, and it also help with that cellulite, that smooth tone and tightness. So it's like a beauty enhancement too. So that's what I like to do to help with the recovery to at least increase the comfort and the blood flow of
Mm,
that BBL.
man, that's fantastic. And thank you so much. Big shout out to our models for being here with us on the show because I'll let you know there's definitely no money involved. I don't know if what you promised, Jasmine, but yeah, we did. So we think we're just gonna give y'all a praise offering or a token of love from the church here. Um, all right, well that's excellent. Let's keep rolling because I got several. Look, I already know it's gonna go. Dr. North and Jasmine, do y'all possibly have an additional 10 minutes? Are y'all able to stick with us till 8:10?
Sure, I can do that.
Okay, we appreciate it. I think I'll be able
Jasmine's gonna get tired back there. You're gonna have to pay her, but I'll be all right.
to.
I'm sitting in this chair.
You sit there. She gonna need a BBL pillow after. Um, let's see. Question: what is the difference between Botox and lymphatic drain? Oh, I guess you're saying the lymphatic draining procedures. What's the difference between Botox and lymphatic draining procedures?
But Botox keeps muscles from moving so that you don't develop wrinkles over time. It actually helps slow the messages from one muscle to the other and from the nerve to the muscle so that wrinkles don't develop. And that helps keep your skin looking young and less furrowed. I guess Jasmine knows all about lymphatic drainage, but lymphatic drainage is actually moving the fluid through the body after liposuction or after other procedures, or just to help cleanse the body. And you're not necessarily injecting anything to stop the movement. It's more of manual manipulation.
Kind of
Awesome.
control recovery and wellness, help your body dump off unwanted pathogens, toxins, bacteria.
Hmm.
That's what they say.
Absolutely. Like we was.
I think people
Okay.
think lymphatic drainage is a surgery because they hear it more in the surgery conversation. But
Okay.
I
Okay.
would like to use it during these times of the year to boost the immune system. Like I work on my boys, I make sure I do lymphatic drainage on them, whether it's wood therapy or the chi swing. Just I like to encourage their lymphatic system so their sinuses won't get backed up and all that.
Okay, okay, that's an excellent point. I don't think I've ever heard of it, referenced like that. So what you're saying is we're not just talking about the surgical aspect that you're saying you on the boards kind of year round to make sure that everything's draining even during allergy season, hay fever, all that. Okay,
Mhm.
awesome. Um, let's see. Anita says, what are the most common procedures that you perform?
I had great training at the University of Kentucky, and I'm privileged. It was very hard. They took two of us a year, and I was the first medical student from the University of Mississippi Medical Center to get accepted into plastic surgery right out of med school.
Mm,
And um, I learned how to do everything from something on the toe to something on the head, and I've been able to use those skills I've learned to kind of hone in on body contouring with liposuction, skin removal, eyelid surgery, breast surgery, but primarily I do mostly body contouring, which includes tummy tuck, breast augmentation, breast lift, back lifts, liposuction, and face lifts, as well as eyelid lifts. A large part of my practice is breast because a lot of people in Mississippi in our areas are good candidates for surgical operations for their breast. And so we have a lot of patients seek out that. And that's kind of how I jump started my practice. And so I'm able to help a lot of people just through referrals. And I also do all my own injectables like Botox and Juvederm, Restylane, fillers like that, lip enhancement, tear trough enhancement. I put a lot of my results on William North MD on Instagram, and that helps me show patients, what you can do and give a realistic goal of, hey, this person looked like this, and we got into that. Maybe we could do the same for you.
awesome. That is awesome. Let's see. How can let's see. We'll put that up there. How can Tiffany's asking us? How can someone tell? Um, how can someone tell if their lymphatic system is sluggish, and what steps can they take to improve it? I'll give that one to Jasmine. Let Jasmine take a stab at it. No pun intended. take a stab at it first.
Okay. Like we was talking about earlier, the neuropathy, the tingling, that right there, feeling heavy, feeling sluggish, um, feeling sick, constipated, um, dehydrated skin, itchy. Like your body will tell you something going on, and most
Hmm.
people think it's something wrong, but it's really your body telling you it need help to get whatever in it out. So they'll go taking pills and stuff to numb the symptoms and stuff, whatever. But really, their body telling them, okay, feed me some water, feed me some vitamins, so I can do what I need to do to make me feel better. So
Hmm.
is that a good way to say that? Cause y'all just got quiet.
Oh no, I was no, I was listening to you, and I was just looking at all these several more questions. These folks, they
But
rolling in, but no, I was listening to you.
yeah,
Uh,
yeah.
let's see. So let's go to Tiffany, and then Tiffany's also asking, does okay? There we go. Does the surgeon provide three lipo 360, and where are you? Well, you can go ahead and tell them. I said at the end of the show we tell them where everybody's located. We let y'all do it. But anyway, do you do lipo 360?
Yes, I do. Lipo 360 is very common because you just don't want to treat the front side and leave the back alone. Because a lot of times, if you're doing a tummy tuck, you're doing liposuction on the front, you start to notice those areas of fat on the back. And, you know, a common thing is, will the fat grow back? Will it come back? We are permanently removing fat cells when we do liposuction. And I think by the age of maybe 1 or 2, some believe just at birth, you're born with a certain number of fat cells. And after those first few years, you will not develop any more fat cells. The fat cells you have only grow and expand. So by permanently removing those fat cells, the fat cannot return in those areas. But if you do gain fat later on, it can go into other areas that you haven't had liposuction. Sometimes those are areas we want fat to be, as far as our face and buttocks and areas like that, or even breast. I'm located in Flowood, Mississippi, off of Lakeland Drive at 1055 River Oaks Drive, kind of between Jackson Prep and River Oaks Hospital, next to McAllister's. And so not too far away to help all the great people of Mississippi.
Awesome, awesome, awesome. Can breast does breast reduction uh, does breast reduction impair a woman's ability to breastfeed later in life? Let's put.
I've talked to all my patients that are breastfeeding age or maybe breastfeeding later on about this. They're all various studies. It's try to give you percentages. I've had many patients that have had breast reductions and gone on to have children that have breastfed. I don't think it increases your ability to breastfeed because some of the breast tissue taken out is actually fat, so you may be concentrating more breast tissue there. But as long as you have a pedicled breast reduction, not a free nipple graft, you are not
Hmm.
cutting the ducts in between the breast parenchyma tissue and the nipple.
Mm-hmm.
Those remain intact, and so you shouldn't not have the opportunity to breastfeed. As far as especially in those first few months when your body is producing the hormones that produce the milk to allow you to sustain that ability.
Awesome, awesome, awesome. Yep. And Reva said that B Score Fitness can help with your butt needs. Yeah, B Score is located South Jackson and do an amazing job. Bridget is there to help with all your fitness needs and weight loss. So I agree, B Score Fitness is amazing. Let's keep it rolling because we're let's see 7:55. So we got 15 minutes. Let's see. Let's go another question. My wonderful mother is on here, and she is asking: is there a usual or a normal after having a BBL?
Uh, you have to explain what that means. A
When you
usual.
say yeah, when you say that, Mom, are you talking about um, like a common kind of uh, prototype or something, or like a standard or something like that? I'm not. Yeah, that's an interesting question, but maybe we'll come back to that if you want to do a follow up comment pretty quick there on their mom. Let's go here. Next one. There's my frat brother, my line brother, Alpha Phi Alpha Fraternity Incorporated. It was just our Founders Week. Shout out to our fraternity. He says Jasmine is very knowledgeable, and this has been a very informative forum. I appreciate that, man. Let's see here. Anita is asking. Let's see here. Okay, Anita says my previous question should have been, what's your most common facial cosmetic procedure that you perform? I see a lot of facial contouring and injections. What do you recommend?
Every patient is so different. The biggest thing I can recommend is with filler and Botox. You see it everywhere now, and it's really a wild, wild west, and it's become unregulated. As a plastic surgeon, I was taught the anatomy and the kind of what is aesthetically or cosmetically pleasing to most patients. And unfortunately, now that everybody does Botox and filler, everybody just wants into that game because it's a cash industry and they think you can just make it big because everybody wants those type of procedures. So a lot of what I do is either using your own fat to fat graft the face so that it's your body and it's not a foreign substance. And that usually requires sedation. So the patients that just want facial contouring and injections, I typically use hyaluronic acid or Restylane that lasts 6 months to a year for volume enhancement of the lips and cheeks and the nasolabial folds. And then I use a neuromodulator like Botox or Dysport to help with wrinkles. But the key with the facial injections is everywhere I turn, there is somebody new that I'm not sure is properly trained offering injectables.
Mm,
And bad things can happen. There are reports of blindness where you actually hit an artery that
mm,
retrograde flow into the eyeball. There are people
mm.
that have lost half their noses. So it's not just a fun thing to do. It's a serious thing. And so you want to, you get what you pay for. And if you're going somewhere that doesn't seem like this is quite right, that's probably the issue because injectables are needles and it's your body. And you got to make sure that it is a medical grade substance. There have been some counterfeit injectables going around. I get emails personally from other countries asking me if I want to buy their Botox and fillers at a huge discount. And no
Wow,
telling what's in that.
Lord have
But
mercy.
there are people that want to make money and don't care about your health. So I recommend seeing somebody that knows what they're doing, and most of us know when we meet somebody if we feel like they know what they're doing.
Hmm. Absolutely, absolutely. That's great information. Jasmine, let's get an update on what you got going on over there. I see you've been hard at work for this.
You know, I like to use my hands, but there's one thing I like to do too with people that's worried about facial rejuvenation. It's a lot of oxygen flow we can get from scalp massage, and I feel like that helps with rejuvenating your face. What you think, Dr. North? I feel like a good scalp scraping help a lot of people with just relaxing their face muscle and just feeling. I guess getting the releasing I guess the rejuvenation they need in their face because sometimes there don't be enough oxygen flow. That's my opinion. Like
Oh
I
no, I think it's just like a TENS unit that chiropractors use. If you activate the muscles, it helps to produce energy and relaxation and helps blood flow going through there. It's the
they
same
know.
thing with movement. That's how you stay healthy and alive is eat well and keep moving. Keep moving.
Mhm.
Sitting is the new smoking, they always say. So even if you're manipulating the scalp and manipulating the face by bringing vasodilation and blood flow, I think that can definitely help.
Hmm. Absolutely.
What do you think about massage pre-op, Dr. North? Because I feel like a lot of people need to actually detox their system before they get into surgery. So your
Yeah,
body can recover faster. You've been already dumped off all the bad stuff, so your body can be ready for recovery.
no, nobody hates a massage, Jasmine. If we could all be there all day long before we come see you, I
Yeah,
think that's a great idea.
Yeah.
absolutely. I got there were some questions that were submitted. We I usually prepare 15 to 20 questions before every show. I had 15 for this show, and I've gotten through one of them. So that lets you all know the amount of enthusiasm that we've had for this episode. Here's a couple quick ones that we can hit. Might be geared a little more towards Jasmine. They were submitted to us earlier. Um, so how long does it normally take for a person's body to respond to detoxification, and can that and or massage therapy help with arthritis?
Yeah, yeah, like one of my models just here, just with the chi swing alone, it activated her lymphatic system in 10 minutes. You want to come tell about your experience?
Come on, tell us your experience. Look, we're live. Come on, let's hear it from you. Come on, tell us.
No, but just from just the activating of her lymphatic system on the chi swing. Come on, come on, come on. Yeah, well, she said it just helped with my back and what else? And it helped relax her. So the activation of the lymphatic system, your body just like Doctor said, the movement. It helps your body do what it needs to do anyway. Any type of movement gonna help your body do what it needs to do.
Excellent. And another question was, what type of compression garment is best to achieve results in the midriff area? I'm gonna let you answer that one, Jasmine. Then I would like Dr. North, if he's got anything he wants to add to that about the compression garments.
Y'all want to see what Dr. North gonna say? Because a lot of people, well, a lot of surgeons don't really think it's a big thing about the faja.
Yeah. No,
And I
I
think
do.
fajas are important, but how they need to put it on is important too. Because a lot of people they'll create that flap on their stomach by
Right.
touching instead of pulling their stomach up and fixing it. It's a lot with that too, so they can mess up their results wearing the wrong faja, wearing it too little, too tight, too loose. So it's a lot of
Right.
research and stuff need to go on with the client to customize how they want their results and how
Yeah.
they need to do.
Yeah, the first week or two after liposuction, at least liposuction or tummy tuck, I just have patients wear a binder because you're swelling and it's just hard to keep that on. And if you have drains, there's no spot to have the drains come out, and you're leaking and it gets wet. But after about 2 weeks, I do have my patients wear a faja. We typically use a couple of different brands. I don't sell them to the patient, but I direct them to what they should get. And the most important thing, as Jasmine mentioned, is get a couple of sizes because you have no idea what size you're going to be before, after. You may be bigger after your surgery the first week than you were pre-op because of the swelling. And so we have seen reports of patients that where it's so tight that they
Mm,
cause burns to the skin because it can't get any oxygen, a shearing or friction burn,
wow.
or pleats in the
No,
faja that cause a crease in the skin, as she was mentioning, can mess up what you're trying to achieve. So a couple of different sizes, something that fits, just to squeeze that fluid out, get it to the feet and back through the system into the lymphatics.
Okay.
it might
Excellent.
be
Excellent.
foams and boards and stuff. And some people they
Mhm.
have allergic reaction to some of the garments. I don't know if it's just because it's the latex in it or what it
Yeah.
is, but they need to put a cotton shirt up under it that's gonna come in close contact with the skin. Some people I feel like had a allergic reaction because of the fragrance that they use in their detergent, and when their body sweat, their area trying to heal, and then got all those toxins going back into their pores. It's just a lot that people do that you have to ask questions and just pay attention to try to help them get
Mm,
the results they need.
wow. That's great. Great points. Great points. Well, look, last one. All right, so it looks like my mother said she has edited her question. She said, "My question, I meant to add the word recovery time." So her question was, "Is there a usual or well, I know y'all went over, it, but maybe if you could just reiterate for the folks coming in, is there a usual recovery time after a BBL?"
I tell patients no pressure on the buttocks for 2 weeks. And after that, everybody's different. We talked about 70% of the fat lives in a BBL. And so the less pressure on that fat, the better. And so no pressure for 2 weeks, just as if you planted grass in your front yard, you wouldn't have a party in the front yard having a big barbecue and a football game on it because you crush all the new grass follicles.
That's right.
Same thing with the buttock. You just don't want to put pressure on it. So 2 weeks is usually the limited time off work. Um, but the overall recovery and healing process may be 3 months. But the initial acuity, I think, is that first 2 weeks to make sure you're behaving without pressure there.
And then after those 2 weeks, like you say, nothing, no weight on the buttocks, and then um, are they able to? So during those 2 weeks when they use that, the BBL pillow, can they drive their car and everything by sitting on the pillow in the car?
If they can, it's just trying to stay movement, stay active. But I'll have patients say, "Can I drive?" And I always ask, "What are you going to go get? Are you going to the dog food store to get a 50-pound bag of dog food and get a big thing of bottled water to put it?" It's just you may can drive, but it's where are you going when you get to where you're going, and what are you
Okay.
doing? And so it's minimal activity just to kind of relax. I mean, your body goes into shock after you've had surgery and it wants to heal. And so by setting yourself up that first 2 weeks in any surgery to let your body give it some grace and heal, you will get better faster and have better results.
Awesome. No, that definitely answered the question. That'll do it for us, folks. So before I do my usual outro, I'd love to give both of you the opportunity to tell everyone who you are. We got your names up there, but if you can just tell them who you are, what you do, your professional title, and where you're located, what you're offering, all that good stuff. Please let the audience know. Let's start with you, Jasmine.
I'm Jasmine Briscoe, LMT 2540. Um, I do massage, localized cryo, cellulite treatment, wood therapy, sculpt ice treatment. I'm specialized in non-invasive Colombian butt lifts using the suction cups. And I'm located in Clinton, Mississippi, 311 Clinton Boulevard, Suite C. Name of my business is Quick Fix LLC. I'm a concierge service provider. I'm mobile. I specialize in personal care. So anything to help my clients get back to their best self, beauty, wellness, call me.
Awesome. But also, Jasmine, like we said during the shameless plug, you'll be offering your services at Good Faith Wellness Center. Is that correct?
Yes, sir. I might be up there with Dr. North too. I can't wait to meet you in person.
Absolutely. Absolutely. And then, okay, and Dr. William, no, yeah, tell us all about yourself, man, and where what we know what you do, but whatever you want to let the audience know.
First of all, I really enjoyed this. It's fun meeting new people, and we all have a different uh, profession or expertise, but we all here on this podcast want to better people's lives.
Absolutely.
And we wouldn't be doing it if we weren't. And so I appreciate the input from y'all as well as the patients. My name, like who says, William North. I grew up in Jackson. I went to medical school here and then did my training at University of Kentucky, and I've been in private practice. I joined Dr. Scott Runnels in 2017, August of 2017. So I'm almost be 8 years coming up pretty soon. And we have a full service clinic here as well as two fully functioning operating rooms that are quadruple A certified. So we do all our general anesthesia here in our own building, as well as we have a spa with an esthetician that does facial procedures and lasers and things like that. I specialize in really all plastic surgery, mainly outpatient cosmetic surgery, as well as I help some of the general surgeons here in town for breast cancer reconstruction of ladies who've lost their breast over at Merit Health Women's Hospital as well as St. Dominic's. And there's not a whole lot I won't tackle. I love to see people and at least talk to them and figure out what goals we can achieve and find out if they've got high blood pressure so I can send them to Good Faith Wellness Center, or if they need a massage,
There we
send
go.
them on to Jasmine.
There we go.
Yes,
There we
sir.
go. My man. My man. I appreciate that one, man. Well, look, thank you all so much for watching another incredible episode of Telehealth Tuesday. Thank you to my guests, Dr. William North and Jasmine Briscoe, and thank you to our two wonderful models who again have done this pro bono. Just want to put that out there again. But thank you all so much for helping us out. We couldn't have done it without you. Next week, we will have Dr. Stephanie Miles Jefferson, who is a licensed mental health therapist. We've done a couple of shows on mental health. This young lady has been featured. She is a celebrity. She's been on Bell Collective. and a couple other shows that are seen, nationwide. And so you don't want to miss this. She's the mental health expert and therapist to the stars. So she'll be here. So with that said, we hope that you'll join us next week, Tuesday, 7 o'clock p.m. Central Standard Time, and bring a friend with you. And don't forget to subscribe to Dr. B TV. That's DOCTOR, the letter B TV on YouTube. You can direct message us or place in the comments the next topic you want to hear. I know that you're going to want to see these two guests back because I literally got through 1 out of 15 questions. And also, Jasmine, I'm sure, has a lot more she wants to show you with even just straightforward massaging. So, you got a testimony, situation, anything you'd like to discuss, please let us know. We'd be glad to either have, or if you have someone you want to see on the show, we'd be glad to have them on this. So, God willing, we will see you always on a Tuesday. This is a place where we treat and discuss mind, body, and soul. And remember, true wealth begins with good health. Bye for now. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. To Michael